Hello, everybody. If you're receiving this video or you're watching this, then you have some interest in our ShockWave Therapy. It's our newest therapy that we introduced to the office. And just to give you a little history of what ShockWave is, this little machine and the process that it develops all started from many years ago in the Pacific Islands where they were doing mining. They were using explosions or explosives to break up any of the mountainside near the water. And what that was doing is creating the actual shock waves in the water, and it was disrupting swimmers going into the local beaches. And so, after research, they found that they could actually compress this energy and use this for therapies. And so, the first progression was to actually use shockwave therapy and its pulses to break up kidney stones. And so you can imagine the pressure that needs to be applied to break up kidney stones, but it was ineffective and very invasive. And so now they thought, okay, what else could we do with this type of therapy? And hence soft tissue and joint therapy. So breaking up scar tissue and fascial adhesions is a very important process for developing a well functioning joints and muscle and soft tissue surrounding those joints. Because what happens when you have scar tissue? Scar tissue, first of all, doesn't have a vascular supply, so it limits the healing process. Secondly, it anchors into joints to where it doesn't get the full range of motion. You can imagine soft tissue is usually pliable, but scar tissue is not. It has no elasticity, so it anchors something in and actually pulls, let's say, a joint forward. So now it's mispositioned, and you're going to lose range of motion and some fluidity over time. And there's going to be other muscles that have to compensate because things aren't operating efficiently. So for the first time, I'm able to work within a joint, break this up, and heal the chronic injury from the inside out. So basically, how that works is using acoustic sound at certain variables and certain frequencies. Basically, air compression is transformed through magnets to send pulses through the skin barrier, break up the scar tissue, break up the adhesions, creating a mini injury, which will first of all revascularize that area, which will bring new blood flow, which will promote healing. It'll bring in the fibroblast cells, which is the repair team of the body, to go to work and start healing that joint from the inside out. Do what it was supposed to do when the injury happened, however long ago. Now, secondly, what happens is as the blood vessels start recreating, you still get that healing process 3 to 5 weeks after the first, second, third, or fourth usage of the therapy. But what that allows you to do is start recreating your new normal. So you've been compensating with the movement for such a long time that has contributed to some of your pain. And the compensatory effort is never better than the actual fluidity of proper posture and movement that doesn't cause any muscles to compensate in the first place. So with shockwave therapy is allowing us to create a small fire, so to speak, in a certain area to clean up the area from the inside out and let the body do its work instead of using any drugs or anything invasive to shut down a system to hide or put a band-aid on a problem. So if this is something that you're interested in, please let us know. I'll be happy to set up a consultation with you, and we could do our first treatment and see how that operates. The process from there is to sit down possibly a week later and create an actual treatment plan. Let's get to the root cause of what's going on with every issue that you're experiencing, and let's find a way to give some long-term relief and long-term response so you can live the best quality life that you choose to do. So anyways, my name is Dr. Jake Levere. And I'm always happy to help. I'm always happy to ask questions. So feel free to reach out. Otherwise, I'll see you in the clinic. You guys have a wonderful day.